How about that? 8:11 now, Steve and Ted. It is Wednesday morning, first day of April. Time for Wednesday with Wagle. Dr. Jason Wagle at Kansas Perio and Dental Implants. Good morning, Dr. Wagle.
Good morning, Steve. How are you doing today?
I'm good. How are you holding up in all of this? Personally, you doing okay? You got your spirits up and everything?
Yeah. Staying healthy. Everything's going good.
Very, very good. Now let's talk a little bit today about, shall we, between the relationship between gum disease and diabetes. Now I have some diabetes in my family. My dad had it late in life. I have a brother who suffered from it. And what's the relationship between gum disease possibly and diabetes?
You know, we've talked about this a little bit in the past before. This research suggests that the relationship between diabetes and periodontal disease kind of goes both ways, where that, if you have diabetes, you're going to be at higher risk for getting periodontal disease. But if you have periodontal disease, you may have a more difficult time controlling your diabetes. It's kind of an interesting kind of relationship there.
So what should you do about it? If you got the information, now what do I do?
Well, the important thing is, number one, is to kind of work on your home care habits. If you do have periodontal disease, obviously you should come in and see Kansas Perio. But, if you have diabetes, you should. It's really important that you monitor your blood sugar and follow your doctor's advice to keep it under control. If it's kind of an important factor. Something that's also kind of interesting that we've been hearing a lot about recently is that patients with diabetes are also at higher risk for complications with the coronavirus. Ooh. And that's something else that's kind of a critical thing that people should be aware of.
Oh yeah, that's when you talk about some of the people who've died of the virus, they say that there were already some health issues. Maybe diabetes could have been one of them, huh?
Right. You just mentioned it on a radio show that the majority of patients have some underlying medical condition. There are people that don't have any underlying medical conditions, but the majority of them do. And one of those factors is diabetes. And again, if you do have periodontal disease, I guess in some ways that can make it more difficult for you to control your diabetes, and therefore you could be at even again a higher risk for the COVID-19 complications.
All right. Thank you for the information. We appreciate it. It's Dr. Jason Wagle. When it's time to get serious about your smile disease, periodontal disease, or anything else, time to ask your dentist about Kansas Perio. Learn more about the services online at kansasperio.com or call 685-2731. Of course, that's 316-685-2731. And Dr. Wagle giving some good information there about diabetes. It's 8:14 now. Steve and Ted here on KNN.